Namaskaram everyone. I am Dr. Divya Pulimi, a clinical pharmacist from Fitness Institute of Gastroenterology. I take immense pleasure in introducing our speaker, Mr. Bharath sir. He completed his bachelor degree in bioengineering and biomedical engineering from Stevama University in the year 2002-2006. He obtained his master degree in biomedical engineering from Pursuit in the year 2006-2019. He pursued his PhD in biomedical engineering from Case Western Service in the year 2009 to 2011. He is CEO and co-founder for Sujivan Health and Wellness Services Private Limited. He is also a former research scientist for Cleveland Clinical Foundation Health and Wellness Coach, USA. Aside from his talents and advocates, Bharat sir has many presentations and publications too. Bharat sir has been awarded along with merit certification for being the topper of the class. Based on his credit and his excellence, he was also the only person to be selected for his class for an internship in National University of Singapore. He is also a member of AIEEE. Bharat sir's primary goal is to deliver the highest quality of health services, which include prevention, promotion, and medical care for all by using an integrated and holistic approach of treating the whole person, that is, mind, body, and spirit. We are all grateful for his presence among us today. I welcome you on behalf of Team Pharmacon Society of Pharmacy Practice, sir.
All right. Thanks a lot, Divya, for your elaborative and a nice introduction of my profile and everything. And it's really glad and honored to be this part of Pharmacon Society for Pharmacy Practice. And I'm really thankful to Karthik and his team for having this session with me here. And obviously, I know Karthik for a couple of months right now, or almost 6 to 7 months, and I've seen Karthik has been doing a wonderful and great job for PharmD students. Mainly, he's bringing people from various disciplines, bringing them together, and asking them to give their suggestions and insights about their work and everything, and which in turn is going to ultimately help PharmD students to guide their career aspects, or even he's striving to change the way the pharmacy is practiced in India, which is all great things about this society, and I'm really glad to be here. So to quick start, let me share my presentation. Just let me know if you guys can see my screen. So you guys can see my screen, right?
Yes, sir.
All right, perfect. Now, so during this session, I'm going to talk about my journey towards starting this company, Sujivan Health and Wellness Services Private Limited. I'm going to talk about what is holistic health, various dimensions of wellness, and summarize the things about health and wellness, and what are our goals and current goals, and what are our future goals. So let me go back a few years of my life and give you a brief overview about how I started, this journey towards starting up my own company. It was probably I was 17 years old in 2002, I guess. Like once I finished my 12th or intermediate, I was quite sure where I want to be, because I wanted to pursue a career where I can bring changes in the healthcare system in India. And there was quite a good reason to have that kind of a goal, because when I was 9 years old, I lost my dad in a road accident in the rural area of Telangana. And it was a minor accident. It was completely avoidable if there was a proper healthcare system in India, it was a very minor accident, and he would have saved his life. And that's when I have decided there is something lacking in healthcare system in India, and once I grow up, I have to bring changes in healthcare. And I had a brief discussion during after I finished my intermediate. I was at the juncture which stream to go for. Is it IT, mechanical, EC, or something else? Then the path was pretty clear. I wanted to pursue biomedical engineering, which was quite a. It was. I was. We were at the first batch at Satyabama University, so I pursued my biomedical engineering over there, and a lot of things are pretty new. And I guess a lot of you guys might have already experienced this doing PharmD here in India. So I was at that point of time, like we were not sure where we are heading to, but in my mind, I knew that after pursuing my biomedical engineering, I want to become a scientist, research scientist. And at that point of time, I knew, I knew my brother who was pursuing his, intermediate, he was in 11th grade. I knew he's going to become a doctor, and I knew both of us going to come together and do something that really helps improve healthcare system in India. And let's see where we are right now. So once I finished my undergrad, or before I finished my undergrad, I went to Singapore so to pursue my internship over there. I was working on a top-notch nano bioengineering of bone tissue. Using nano engineering, I was using all these bone cells to actually get the bone cells grow in the scaffolds using nanofibrous tissue engineering. And that kind of research I was doing, and mainly it was all about detection. Initial career of my the initial career was all about working on detecting a certain disease or conditions using some different technologies, or specifically I was using medical imaging technologies, using MRI and multinuclear MRI to detect certain diseases and non-invasively. And I was successful in doing that. I've worked on sodium MRI, oxygen MRI to detect diseases related to heart, related to kidney, like acute tubular necrosis, ischemic ischemic heart diseases. So those sort of things I was working on. I was and I've really published few papers on that, which was nice, and it was very insightful about how doing research in a specific field can actually give a lot of insights about a particular sector. And in the field, in this regards, I was looking more into the detection of things. Later on, I actually worked as a research scientist at Cleveland Clinic Foundation. And the goal here, as a research scientist, I was working on phase 2 clinical trials on a drug called ibudilast. And the goal here was to actually look into the efficacy and the safety of that drug called ibudilast. And I've successfully worked on phase 2 clinical trial, and it gave us hope for phase 3 clinical trial and to get that drug into the market. So let's see if this video is going to be played. He is my mentor and advisor. Around the world with now we work with a team of doctors, psychologists, physiotherapists, dietitians, yoga therapists, health coaches, physical trainers, pharmacists, and lab technicians. To our credit, so we once after we started in February, March, the things have changed across the globe, right? So with the COVID situation, we were at the forefront, actually helping COVID patients with our health and wellness center in Hyderabad. We have started our COVID care programs on June 1st, 2020, to help prevent to help prevent the infections to be spread, and also the treatment of COVID patients at home and in hospitals environment as well. Now we take so much pride in doing conducting the COVID care programs across Hyderabad and across Telangana. We have helped more than 300 patients recover from COVID successfully with 100% recovery rate. Now, what's in the future? Now we are actually in the process of developing an app which will be released soon, which is probably in the May of 2021. And so which actually this app involves all the aspects that we are doing here with respect to integrated and holistic approach, and which involves all the key stakeholders, or all the service providers here that I mentioned earlier, with the team that we have here, right? So we want to provide the healthcare services to everyone, to all, using the holistic approach by using our app. So far, so good. Like you guys can hear me, okay, right? And everything is fine.
Yes, sir.
All right. Okay. Now, so I was talking about the holistic approach to health and well-being. What is holistic, anyways, right? So, what is philosophically, it is characterized by the belief that the parts of something are intimately interconnected and explicable only by reference to the whole. So, in general, it's philosophically, it's called, it's just a whole. It's referred as a whole. And in medicine, it's characterized by the treatment of whole person, taking into account mental and social factors as well, just rather than symptoms of a disease. That is the holistic definition. And what is health? Like people think like health is just free, state of being free from illness or injury. Is that the real health? But it's also actually the physical health also involves the mental aspects. It also involves the whole body, the mind, and also the spirit. That is the definition of health, and that is what the holistic nature here. We look into whole person's body, mind, and spirit. Now, so in conventional medicine, what are the differences? The very apparent differences here compared to conventional, the holistic and holistic nature is, in conventional medicine, body is treated as a machine, and in holistic, body is treated as a garden, right? So in conventional medicine, the definition of health is about the absence of disease and functioning within normative parameters, whereas in holistic world, the health definition is all about integrity, adaptability, and continuity. In conventional world, the outlook of medicine is all about, it's actually medicine is a war on disease with doctors as generals, disease as enemy, and patient as occupied territory. And the goal of medicine is to eradicate symptoms and maximize performance. Whereas holistically, medicine is all about to cultivate health with doctor and patient in partnership to improve ecological conditions. And the goal here is to enhance self-regulatory capacity. In brief, here's the difference between conventional and holistic medicine. In holistic medicine, it's all about how you approach and the wellness. It's about approaching your wellness with the whole body, and prevention as well as curing is involved in holistic medicine. And holistic practitioner actually has holistic medicine involves strong relationship with doctor. A person who approaches holistic medicine, or they have a better sense of control over their own health, and is also less expensive in general. Conventional medicine is obviously, you guys know, it's a science and evidence based. It's all about symptoms based curing, and it is practiced by highly trained practitioners. If you see the drugs, they are highly the drugs that you give to the patients are highly goes through the quality control, and they are strictly regulated. And mostly the conventional medicine, conventional or allopathic medicine is accepted by health insurance companies in general. So that's about the holistic health. And what is wellness, by the way? I was talking about health and wellness. Company is all about health and wellness. What is wellness, anyways, right? So it's a condition obtained when a person achieves a level of health that minimizes the chance of becoming ill. Wellness is achieved by a combination of emotional, environmental, mental, physical, social, and spiritual health. So here at our company, we actually focus on 8 dimensions of wellness. So why do we have to focus on 8 dimensions of wellness? It's simple, right? So if a person is affected by any form of wellness, any wellness aspect in their life, their health and well-being gets affected. Let's say a person is physically well and he's doing really well physically, but his finances are bad, then his well-being gets affected. And his environment is bad, his physical wellness gets is good, but overall well-being gets affected, and so on. So if a person is not good, doing good in occupation, or their life, work-life balance is not good, their well-being gets affected. Mental aspects, environmental aspects, social wellness, intellectual wellness, financial wellness, and spiritual wellness, all of them put together, a person is considered to be doing well in their life. So it's all about that. So we just didn't want to take care of their physical health alone. Is something everybody understands, that they have to take care of the physical wellness, but there are 7 other dimensions of wellness which will really get to know about, which will really help a person to be happy, and their well-being will be at their fullest once they take care of all these aspects of wellness as well. So that's the whole point of having 8 dimensions, and we take care of those 8 dimensions of wellness at our company and to our clients. Now, the physical wellness. It encourages us to care for our bodies through physical activity, nutrition, and strong mind, which we all know, physical wellness. Intellectual wellness encourages learning, curiosity. It also helps to engage in creativity and mentally stimulating activities. Emotional wellness inspires for self-care, relaxation, stress reduction, development of inner strength. And spiritual wellness, it is not only, it's not just about seeking meaning and purpose in human existence, but it also allows a person to appreciate their life experiences for what they are, and also to develop a harmony with their inner self and the outside world. It also grants you balance. Social wellness, by maintaining this social wellness at an optimal level, it allows you to build a healthy relationship with others, to develop assertive skills and become comfortable with who you are in social situations, and also increases your self-esteem or self-confidence, and also to build emotional resilience. Environmental wellness encourages, with respect to, it encourages you to have the respect of all the species living in it, to practice habits that promote a healthy environment, and it helps you to have a more balanced lifestyle. The occupational wellness inspires to prepare for work in which we will gain personal satisfaction and find enrichment in our lives, allows to explore various career options, encourages you to pursue the opportunities you enjoy the most, and also it helps to recognize the importance of satisfaction, enrichment, and meaning through work. Financial wellness. So a lot of people have this financial responsibilities, and it can be overwhelming, right? So, but ignoring them will only increase the feelings of stress, anxiety, and fear. And so, financial wellness obviously will help you to feel less stressed, and also developing financially smart habits is a valuable investment to achieve your future goals. To summarize things, so what is health and wellness, and what is well-being in general? So well-being isn't just about being happy or wealthy or successful or in a good physical health or wellness, right? So it's all about combination of our love for what we do each day, the security of our finances, the tips, the vibrancy of our physical health, and our role and contribution to communities. And therefore, health is not just the absence of disease. It is about integrity, adaptability, and continuity of the body, mind, and soul. But adapting, healthy lifestyle, it actually improves. These are some of the very, some of the benefits that we have, like adapting lifestyle. It improves mood. It enhances the sleep and increases your energy levels. And also, it also helps you to have a healthy weight loss. And also it helps you prevent the diseases and injuries. So now, like, what are our goals basically? Now having said all this about the health and wellness, all the 8 dimensions of wellness, the goals here of Sujeevan Health and Wellness company is to provide healthcare services, acute care, primary care, and preventive services to all. It also we also have the goals to promote illness prevention through health and wellness education, and we are continuously assessing the health needs of the communities and implement our health and wellness programs. And our current goal is actually to successfully launch our app and cater health and wellness needs of all. And these are all the services that we actually provide here at Health and Wellness Center. It's not, so we all, like I was mentioning earlier, it's about integrated approach or integrative approach to the healthcare. And we have doctors, pharmacists, labs and diagnostics, dietitians, nutritionists working with us. And we are tying up with some fitness centers, wellness centers. And we do have therapies, relaxation therapies, and health coaches. We also look into the health insurance aspects of well-being and for the well-being of the clients, and also we cater some health products for the well-being of the clients. So this is what we do here, and so ultimately what we want as a company, or as a health and wellness company, is to see everyone to be healthy, happy, and not just physically well, but also socially, economically, psychologically, emotionally, all put together, and take care of all their well-being aspects. That's about me and my company here. Any questions, guys? Yeah, hi, Karthik.
So actually, we yesterday had a conversation and deliberately decided to talk for a very short time and have more time for interaction. So if anybody has it, you can ask me. So nobody has a question. So I have. Can you just discuss any one of the cases which you have seen at your clinic and how patient recovered with all this approach?
Right. So one of the major applications that we are doing currently, I already mentioned about the COVID care program. So we applied the holistic approach because there is no medicine for COVID. As you guys all know, there is a vaccination currently, but there is no treatment as such. So what we have implemented using our holistic approach is the doctor's consultation, online consultations of doctors. So we would have the COVID patients to undergo some yoga or meditation, some breathing exercises that will enhance their breathing capacity. So, and at the same time, we would ask them to have a diet consultation. So we have dietitians calling them and giving them some diet, what kind of diet they are supposed to take. And at the same time, so our wellness coaches would call them and regularly be in touch and following up on a daily basis, like at least 2 to 3 times, and taking their vitals. So our lab technicians were involved in this. Even the I'm glad to actually have our employees, like we have at least 6 to 7 Pharm Day students working with us during this whole process. And even they did a wonderful job to go to the patients, and even taking care of COVID patients during this during this COVID season. And I'm really thankful to have Pharm Day students because they are knowledgeable about multiple things at a different level. So even they were so enthusiastic, and they actually went and took care of COVID patients when there was at a peak level, like even in April, May, when people were so scared to actually see a COVID patient. These guys would take all the measures with all the PPE kits and everything, go to the patient's house and take care of the patients in person. So that's something that I'm really, I just wanted to put it out there. From these students have done something great with our company, taking care of COVID patients in general. But now the second thing that we are all our focus right now is to get into the cardiac wellness programs, diabetic wellness, and weight loss programs. So even hypertension wellness programs. So we are also going to implement the same methodology of including the doctor's consultation, diet, fitness, therapies, wellness coaches, motivating and taking care of them on a daily basis. So all this integrated and holistic approach. So here at fitness, we are actually including mostly the yoga and meditation. The diet, obviously, by the dietitian, physiotherapist also gets involved in this. So there are several aspects of the holistic approach we are including to take care of our cardiac patients and diabetic patients, and even for the weight loss. My brother being a cardiologist, so we do have a lot of cardiac patients. We have implemented this, and they have still under they're not outright. I can just say they have recovered, or they have went through this rehabilitation and completely came out of it, because it's a very short span of time. Usually it takes at least 12 months 12 months, even 24 months to completely see the results of our policies, like especially if they're depending on their condition.
So, and the other question I have is as a part of PharmD program in 5th year, we do a project for 6 months. Students approach me to help me select a topic or select a site where they can do their project. So is there any possibility for such students to work with you and do some research?
Absolutely. So like I mentioned, there are at least 6 to 7 PharmD students in their final year, and a couple of them have finished their PharmD. So they are doing some projects here at our wellness center, and they're doing, like I mentioned, they're doing a great job here. There's always opportunities to do projects. Now, once we are done with the wellness program that I mentioned, we also are planning to get into several other wellness programs, like even student wellness program, corporate wellness programs. There are any other health conditions. Actually, in fact, during the last summer, at least 18 to 20 PharmD students have done. I guess some of them might be already here, like Mahima and Prem. So they were doing some project works for 2 weeks or so, and it was completely online. They've submitted the project works, and we have given the certifications as well. So yeah, absolutely. So we do have internship programs for PharmD students, and we can help them out with their projects as well.
Actually, Mahima, if you are free, you can share your experience of working with Sujeevan and Dr. Bharath. She told me many times, but I wanted other audience also to know.
Sure, yes.
Mahima, if you are...
Yes, sir. Good evening, sir.
Good evening.
Yeah, how are you, sir? It has been very long talking to you.
Right. Yes. Yeah. Good. Good. We are doing good.
Yeah, okay, fine. As sir has told, like we have been working with sir. I have included like from PSPP, Akila, and many other people were working along with us. And like we have completed the projects which sir have asked us, and like that has helped us many things to learn, like what are the pathophysiologies and what are other holistic approaches other than these medicines like we use in our daily life. Other than this, what are the lifestyle modifications and all things. Like it has helped us how to make a project in a good manner, and also it has helped us to learn the things, many things from that, like how a disease to be treated well, not only through medications, through other holistic approaches. So in short, this is my experience. Like I felt it good, and it has helped me a lot. Thank you, sir.
Yeah. Thanks for Mahima. And yes. They have done a really good job, Mahima and the team, in organizing things, and they have delivered the project right in time. I guess, like, yes, we gave the opportunity to learn, to conduct a project in the right manner and deliver it at the right time, which are all important for aspects for even when you guys are going to work in a company or anywhere in the wherever you guys have to. So those there are few intricacies that you guys have to follow, and Mahima and the team has really delivered that, and I'm very glad to have them, in our team during the some last summer. Any more questions, guys?
So if you don't have a question, anyways, you should definitely ask a couple of questions. But if you don't want to ask a
Hi,
question and share your feedback, you can do that also. Like, what did you
Yes,
feel
hi,
when
sir.
somebody.
you?
Hi,
Yes,
sir.
hi.
My name is Lokeshwari. So my question is how to get these internship opportunities under this program.
So you can email me. I can forward that email to Karthik or Mahima. So you can, or even during my presentation, I mentioned the email and the website was mentioned. So you guys can go through, email me about your profile and everything, your interests based on the availability, and if your interest and our availability or matches, then we can go ahead and do. You guys can go ahead and do the project.
Yes, sir, sure. Thank you.
Yeah.
So, Dr. Bharath, actually, we have close to 150 participants in this session, and they are
Awesome.
from at least 125 different cities.
Oh wow.
So, my goal was to connect all of them to you and see if they can just transfer whatever little they have learned, if not the actual program, but the concept of health and well-being. Because
Correct.
as
So
you know,
I want to listen from you guys. Like, what do you guys think, and are there any? So we are obviously, I'm not an expert in this because we are still a startup company, and I want to listen from the pharmacological point of view. How is there anything new that's happening in pharmacological world that can help the well-being of of our patients? I guess I just want to hear from you guys.
so share your thoughts.
Mhm.
So I don't think we can approach and interact this freely with anyone with a similar profile like him. Okay. So we
Yeah.
don't even get an access. So today we had that fortune. So I want you to open up and talk. If required, we can stop the recording also if you feel shy.
I don't think these guys are shy, but just probably lethargy. It's already 7. Mahima, so what did you learn? So I just want to ask Mahima, and from past 6 months or so, what's new happening in pharmacological world that can be implemented, at the well-being of people?
Yeah, yes, sir. Like, what I have learned is like not only the allopathic medications, through allopathic medications, if lifestyle to be changed, then it would show a great impact on the patients. like as already like you are doing. And even we had the session before on lifestyle modifications.
Mhm.
So keeping this all apart, like it may help the patients if we bring these all thoughts together.
Right. So, so anybody interested in the clinical research, like, that's what I was doing in the US, like as a research scientist, I was working on clinical trials. Do you guys have any questions on that?
So actually, if you don't have a question, you can just share your thoughts on what you felt listening to this talk. Actually, at least I am very new to this concept, though I have heard it here and there, but I did not attend a proper session. We did one session in this module where Dr. Ravi
Mhm.
is board certified in lifestyle medicine. So
Mhm.
that is when I actually listened to a talk on this holistic approach. And today I
Mhm.
really enjoyed. I got to know many things, so
Good.
which I
Good.
was ignorant of previously, and it helped me actually for my condition. I like consulted few Ayurvedic doctors.
Mhm.
Their approach, I was really happy, and within instantaneously, I realized all other ways are like very superficial and they don't really go deep and address
Mhm.
the core. And he encouraged me to do certain exercise kind of thing,
Mhm.
diet modification. So whatever he said, I still follow. This consultation happened maybe 3 4 years back. So I'm
Mhm.
really seeing the benefits. I did not get a relapse for last 2 or 3 years. And I'm
Yes.
doing really well. And I honestly think it is not just the medications which I take, but the other aspects which I incorporated, like exercise, yoga,
Correct.
meditation, diet is really helping me. So, and I'm sure this will pick up in few years time where this will be
Absolutely.
as important as the medication which patient receive. So,
Correct.
and I'm glad you came back to India from US,
Yes.
started this. We will be happy to collaborate or help and in any possible way.
Sure, Karthik. And I'm glad that this work in your personal life as well. So, come out of the disease or the condition that you had, and so you rightly mentioned it's not just about one kind. It's all about integrating, like yoga, diet, other lifestyle modifications that actually helps in coming out of certain diseases, which is not just possible by medications. Sometimes, don't get me wrong, but medications are good. Actually, my brother, he's an allopathic medicine practitioner, so I'm not against it. But along with the medications, along with different kinds of medicines that we practice. Sometimes it's good to actually understand which sort of medicine helps is good at for which disease or condition. Sometimes Ayurvedic or naturopathy is good for some sort of diseases, and implementing that along with medications or even the proper diet and lifestyle modifications will help you guys to get out of that particular disease. So that is the whole point here. So when I was working as a research scientist, or before that, during my master's and PhD, I was doing some really fascinating research. It's all good, but to get any drug into the market or to have that application really change the person's life, it would probably take 10 years, 15 years. And I was not, and so probably half of my career would be gone just developing one drug, which might or might not change, or help a person to come out of that disease. So which is not interesting, which I felt was not interesting. And then holistic health, I probably during this past 1 year, I've came across different condition with clients with different conditions, not just cardiovascular, but on a daily basis. I sit here, people with gynecology problems, or stress related problems, mental, emotional, so different problems. Like I'm glad being here, sitting and talking to patients and learning from them, and also giving them the guidance to get out of their conditions, not just specific to a particular disease. Like let's say when I was doing my PhD, I was working on heart. When I was doing a master's, I was working on kidney, and later on I was working on brain. But now, as a holistic approach, I'm seeing the clients with any and every health problem, and they come here to for guidance and to understand how they can use yoga or diet and other therapies to come out of their condition. And we are still in a very infant stages, but there are lots more to do, lots more to learn and implement. But ultimately, it's all about teamwork. It's not just by me, but we have a team of, like I mentioned, doctors, psychologists, therapists, health coaches. Everyone put together. They come and deliver the right health outcome for a patient. That's what is needed, and it's not a small job, but we're trying our best.
Yeah, Akshara, actually, you can unmute and ask the same question. So.
Excuse me, sir. I wanted to give my feedback as well as I had a question. So first of all, thank you so much for today's session, sir. Your entire journey was truly inspirational, starting from, as you said, detection, protection, and finally preventing it. I was always, we heard this definition of holistic approaches. Everyone had their own definitions, but we were not clear how the approach actually worked. Today, you made us aware on how actually things work, concentrating on the overall well-being of the patient, the 8 dimensions. The 2 slides were really amazing, sir. The body as machine and body as garden. You clearly explained it, sir, how the things actually work. Sir, I even wanted to ask you this: does the center gives any psychiatric well-being? You said the team had psychologists as well. So, does the center take up any psychiatric disorders, sir, like schizophrenia or sleep-wake disorders? Because even if we treat such diseases, the doctor doesn't have enough time for counseling.
Right, Shazia. So thanks a lot for your kind words. Yes. So we do take any kind of even the mental, emotional, kind of diseases, and schizophrenia is something that we see. Honestly, we don't say no to any problem. Like we undertake everyone. Like we have a team of more than 100 doctors, a few psychologists, psychiatrists involved in this, and for any health problem. So we try to at least give a solution. If not, we'll suggest them where to go, what kind of who is the right person to approach for their particular problem. If that person is not, that particular specialty doctor is not available with us, we will at least suggest them the right place to go. And ultimately, we will try to inculcate the fitness, even any condition. So we would like to go, we will suggest them the holistic approach, right fitness activities, the right diet also helps your mental, problems or emotional problems as well. So and also the environment, all the 8 dimensions of wellness. So we will try to get the root cause of their problem, right? So once we understand the root cause of the problem, then it's pretty easy to actually guide them to the right place or to give the right suggestions. It's all about the root cause finding and asking them to do some modifications in their lifestyle, which can help them get out of their condition. Yes, so that's what we do, and we do take care of mental and emotional well-being as well.
Sir, this is Divya. I just want to give a feedback. We are extremely privileged to hear from you, sir, about the holistic approach, and it's great to know that PharmDs are playing significant role in the contribution of a better outcomes, as well as to your company, sir. Thank you.
Sure, thanks, Divya.
Dr. Bharath, actually, Shazia is working on a project related to cardiology, identifying the risk factors and trying to minimize those risk factors, at least the ones which are modifiable, and also some secondary prevention strategies. So Shazia, actually, you can suggest, maybe you can get in touch with Dr. Bharath later and see if he can recommend some strategies for secondary prevention. And Divya is working at a gastroenterology hospital as a clinical pharmacist. So maybe even Divya can try to incorporate certain things in your patients. At least in GI cases, a lot of diet lifestyle will matter. It matters in every condition, but at least in GI, it has a lot more importance.
Absolutely.
And now I will ask a question to all the students. So how many of you felt any stress or exam related, or it can be anything else? So you can post in chat box. Did you like face across any stressful situation or anything so far? Like you can respond in chat box.
Hello, sir. Good evening. This is Abhilasha. Hello, sir.
Yes, go ahead.
Sir, recently I read a book called Happy Healing by Dominic Borlet, where the author implemented 8 steps to treat the physical and physical pain and discomfort by through approaching in an emotional way. So, is there any evidence that while we are planning, while we are treating the patient emotionally and we are healing the physical pain, is there any evidence we can do that?
Yeah, so that's a good question, Abhilasha. So there is a connection between your mind, body, and your spirit, right? So there is, I'm not really sure how far, like what kind of pain it is, and if it is something, that's got to do with the, nervous pain, or like the, the skeletal or bones. I don't know which part of the pain that he was talking about, but there is a connection between your mind, body. So if you take care of your emotional and mental aspects, I came across few studies which were showing that you can relieve the pain. But there needs to be some further evidences, I guess, like, further evidences and scientific research has to be done, I guess, to make sure whatever they're claiming is to be correct. But something that along with those lines, that's what we are, I would like to go ahead and do some, research as well, like, coming to patients. A lot of people actually come with knee pain, spondylitis, and, they ask, like, if there is any holistic approach to for this treatment. We do say that, when I ask them to go with a psychologist, they will be laughing at me, right? So why do you have to for this pain, like, why should I go ahead and consult a psychologist for this? But there are certain studies that shows not just the pain, but also even the cardiovascular, that obviously with respect to anxiety or depression, which is leading to a cardiovascular disease, you need a psychologist treatment as well. But in India, I'm not really sure how far people would be accepting a treatment of your mental and emotional well-being using a psychologist. There's still some stigma associated with that, and that needs to be taken care of. But I do believe mental and emotional wellness plays a major role in physical wellness.
So, Dr. Bharath, actually, we asked one question and almost everybody in the chat responded yes. So, are there any...
Going through it and just it goes viral.
So,
Sorry.
do you have any plan for students? I think you were mentioning, right, some student programs, something like that.
Correct.
So I'm really interested to
So
explore.
that's a good question, Karthik. So very soon we are planning for a student wellness programs, starting from primary school to education to even undergrads, or even the medical students, and all sort of students. Like, but it's going to take some time, I guess. Like probably in June or something, we are going to conduct some workshops with our in-house psychologist. Like, she's really good in taking care of students' wellness aspects, especially their mental and emotional. So we are planning to conduct those programs sometime in June.
Okay, so any other students? I think we have a few more minutes. If you can share your feedback or thoughts, we can do more.
Hello, sir. Good evening. This is...
Yeah, for him.
Hello, sir. Good evening, sir.
Good evening. Yes.
Hearty welcome to PSPP, sir.
Thank you.
and I am your student, sir. I worked
Yes, I remember. Fahim,
project.
how are you?
You remember, sir?
Yes, I do. I do.
Yes, sir. I'm good, sir. Yeah, sir. I was waiting for your session again, sir. Today I was waiting half an hour before, like 6:30 kab hoga, and when this session start, and it was very pleasure listening again to your session, sir. Thank you so much.
Sure. Thanks a lot for him. Thanks a lot for your really kind words. Yes.
Good evening,
Hello,
sir.
sir.
Good evening.
Oh, my-
Yes, Arshini.
Yes, sir. Good evening. This is Harshini. Actually, you just mentioned a point earlier saying that how Indians will accept like going to a
Mm.
psychologist.
Mm.
I don't want to make it as Indians in common, but I want to put a
Mm.
situation in front of you. Like
Mhm.
generally, the illiterate or the people from rural areas, what they expect while coming to a doctor is that they just go to the doctor, they tell that I have a pain here, and they expect them to give a tablet and just let them leave. Like that is what
Mm.
they generally expect when they come to a hospital. And suppose if there is a person like that coming to you, they obviously won't understand like how a mental health can affect their uh,
Mm.
i- an individual. And suppose like how would you handle that situation? Like how would you convince like agree to you or listen to you and then follow you? What would be your approach of convincing them or talking to them?
Let's see. So it's pretty straightforward. I mean, if a person is very stubborn about their way of seeing things in their world, it's not that easy, right? So my approach would be simple. I mean, if they really want to have just medications, just go ahead and do the medication. But I would try to explain them what are the benefits of having going through this holistic approach of actually, it's all about educating people. You rightly mentioned it's not some people or not that so people coming from if they're illiterate about things they would not be convinced no matter what you say, right? So but at least if they are willing to understand and if they keep an open mindedness, then they would be happy to listen to what we are saying, and if they agree then we will go ahead with that. Otherwise it's better to just take care of things in a way they would. It doesn't matter, like it's all about believing things, and if you don't believe in certain thing, doesn't matter. Even if you approach take a holistic approach, it's not going to work for you. It's all about believing things. Yeah.
Yeah, sir. Thank you.
So Sheshma, I think you can talk now.
Good evening, sir. Yeah, sir. Really, it's a sorry, sir. G- um, it's a sorry for interrupting, sir. I'm getting somewhat okay, sir. Let the food be the medicine and the medicine be the food. It's really 100% true, sir. I really believe it, and seeing that, I think it's a great job you're doing, and from that, more people can have helpful from you.
Yes, thanks a lot, Seshma. And yes, that's our motto here. So let food be the medicine, and medicine be the food.
Yeah, Satya, I think you also raised your hand, so you can share.
hello, sir. This is Satya.
Hi, Satya.
It's good to see you in Pharmacon Society Pharmacy Practice. Thank you so much for joining us, sir. Sir, I'm a pharmacogenomic aspirant. It was great to see that you brought up epigenetic concept and as a part of preventive medicine.
Yes.
So, sir, since you asked us what is the current trends going on in pharmacological way of treating patients, so this is the one area
Mhm.
which now is on the rise. So research is on the rise, but the clinical implementation is still in infancy. So
Mhm.
maybe pharmacogenomics and precision medicine can like take over from maybe
Yes.
this is the future now. So maybe like in your wellness center, you can look more into it. The preemptive genetic screening can help uh, to decrease many things like in disease perspective and also medication perspective. So yeah, sir, this is what I wanted to say.
Yeah, yeah. Thanks, Satya. So that's a good suggestion. So that's what we would like to get into in the future, in the near future. So that's so that's in line for us. So yeah, thanks, Satya, for your suggestion.
Hello, sir. Good evening. So you have said that holistic approach is in long-term care. Then how will be the follow-up process done either regularly or in what patterns? And I also have a question like how the adherence outcome will be compared with convention. Because in conventional patients will be missing to attend the follow-up or missing the dose like that. You have said that in holistic we will be telling them to practice yoga or anything. How will be the adherence pattern?
Mhm. Yeah, that's a good question, Sojanya. So, yes, it is because the conditions that we're trying to work based on the lifestyle modifications or chronic condition. It's not just take a pill and that then you're done. So, right. So these are all chronic conditions. They're all the whole life. You have to be taking the medications and you have to be in that state. For that. So it takes some time to actually adhere to have that adherence, like with the yoga or the proper diet and the following up of things. Like you asked about how do we follow up. Like we have in-house health and wellness coaches. These coaches actually do the follow up, and we do take care of their all aspects of well-being. We just ask them a few questions, just some notifications or pop-ups are going to happen. Like they will just try to keep them in track of their goals. So initially, we take their health history, and we also have a timely. We want to understand their whole lifestyle. Like initially, before getting them into this program. Now, once we have complete understanding about their lifestyle and their family history, health history, based on that, the health coaches will try to give them a few suggestions and also follow up, making a right follow up at a regular basis or almost daily basis until they achieve their goals. Yes, it is life's. It's not just it's not like a magical pill. Like we take this holistic approach one day within a span of 1 week or 2 weeks, then the whole your condition is gone. But it do take some time. But it's all again, it's a lifestyle modification. So you have to follow this all your life, even though it is you have recovered from it completely. There's even you're in a good control of your disease. Let's say a person is diabetic and the person is controlling or managing the particular disease or diabetes, and eventually if it is reversed, ultimately that's what we want to see in our clients, like the particular disease is actually reversed completely. But it takes some time, and following up is done by our health coaches.
Thank you, sir. And the session was really like a new concept, but I felt like, okay, why can't we work on this topic? Really will be glad to work with you, sir, for doing internship. Thank you for the session also.
Sure. Thanks a lot, Sajid.
Yeah. So thanks, Dr. Bharath, for your time. So we already took 7 minutes, 8 minutes of your time extra.
Yeah. It was very interactive. I liked it.
And I would like to just conclude by sharing my experience interacting with Dr. Bharath for last couple of months, I think. So what I really loved and got inspired was his decision to move back to India. He might have been making a lot of money abroad, but he really identified his passion and he moved back and striving from zero to whatever place he is now. And I'm sure it will pick up in future and it will be a revolution. So that is one quality I invite. And second thing was his humility. So I don't even call him sir. Okay. So I'm calling him Dr. Bharath. And he's very approachable. Like whenever we talk, last time when we talked for over 1 hour. Okay. So I don't think anybody with his qualification and profile will give me an hour to talk. So these are two really important qualities I picked up from interacting with you. And I hope all of our students learn certain things. And thank you so much. And if you have any feedbacks, you can share in chat box before we goes.
Thanks a lot, Karthik. So I really enjoyed talking to you as well. There are a few things there are some commonalities between us. Like, you are also striving to improve the lives of the family students, and I'm doing something on the same lines to improve the lives of people in general. So that's the reason why actually, I could spend as much of time talking to nothing special, but yeah, I really enjoyed being here, and thanks a lot for having me, Karthik. And right away, so it's actually, we are a budding company. We need as many blessings and, as many hands as possible involved in this to make this a successful and a growing company.
Yeah, just keep that box. You got a lot of blessings and you continue to get. So I'll upload this video on YouTube. I think anyways it is streamed on YouTube, and you can see their thoughts and feedbacks on YouTube as well. And last thing is actually, when we talked for first time, like he understands the value of family. Like he said it is his statement, not my statement. But they learn a lot of things. They are really underutilized. So it is fortunate for some people, because we always go in search of people who recognize our value, especially in family. And we're happy to find people like you who understand its value without we having to give a lot of explanation and convince. So yeah, thank you so much.
Sure, Karthik.
So Alvin, we can end the session, or yeah, so you can just have an eye on your chat box.
Great. Yeah, I'm reading them. So thank you, sir, for bringing up this topic. What is the question?
And Dr. Bharath connected me to his brother. He will also be talking to us on 20th.
Oh, yeah. So on 28th February, right? So he's also excited to share his views on health and well-being